Most people know that Medicare Advantage plans often come with extra benefits like dental, vision, and hearing, for example. But did you know that some Medicare supplement insurance policies come with similar extra benefits as well? Yep, some do. And that is what this video is all about. I'm going to go over some of the more common added benefits from the ones I like the least to the ones I like the most. But first, it's important to understand why so few insurance companies offer these benefits along with their Medicare supplement policies, while so many Advantage plans use the extra benefits as a main selling point. Now, there are a couple of reasons for this. First, did you know that in many states it's illegal for a licensed agent to discuss in detail the Medicare supplement plan extra benefits before the sale of the insurance policy? We can only tell you as oh, by the way. This means that the extra benefits can't be used as a selling point for a specific supplement in many states. And that's kind of wild considering Advantage plans lead with their extra benefits, but that's just the way it is. The second reason is the Medicare supplements simply don't have the profit margin to add a lot of extra benefits without also raising prices on a regular basis. For example, the average Medicare supplement policy post-COVID spends between 80 and 85 cents of every dollar in premiums on current medical bills. That means that when you send an insurance company $100 for your monthly premium, between $80 and $85 goes immediately to pay other people's medical bills. That leaves the insurance company with just 15 cents on the dollar to operate and to pay overhead and wages and so on. Knowing this, consider my least favorite extra benefit, which is Silver Sneakers gym memberships. Now, Silver Sneakers gym memberships cost between 7 cents and 9 cents per dollar. So the cost of Silver Sneakers alone takes half of the 15 cents the insurance company has to operate with. So why is Silver Sneakers my least favorite of all the extra benefits? I'll explain in a moment. But first, hi, if we haven't met yet, I'm Matthew Clausen, CEO of MedigapSeminars.org. We are one of the country's premier insurance agencies specializing in Medicare. In fact, I'm licensed in every state except Massachusetts, and our services are free to you, the consumer. So reach out to us for expert guidance. You'll be glad you did. And if you learn from this video and want to see more of my content on Medicare, please press the like button below and subscribe. Also, select the bell icon so you're notified when new videos are published. Now, if you're already a subscriber, thank you, but please check the bell icon. And we have found recently that many subscribers are not being notified when new videos are posted. So just check the bell icon. All right. So why is Silver Sneakers my least favorite extra benefit? Well, there are several reasons. The first is, as I pointed out, it's the cost to the insurance company. It costs so much that there's no way a Medicare supplement plan can offer Silver Sneakers without eventually having much higher than average price increases. In many cases, after several years of price increases, I've seen insurance companies simply drop the benefit. Then the consumers are left with a high-price supplement plan and no Silver Sneakers. The second reason is that I've seen a lot of people choose their supplement insurance based only on the fact that they offer Silver Sneakers. Future price increase potentials totally ignored. And this usually leads to a very negative outcome for the consumer. As we look at some of the other extra benefits, keep in mind that some benefits are not part of your contract. And if that's the case, they can be removed or modified at any time. And Silver Sneakers is one of those that could be in your benefits in that way. So other benefits may be a part of your contract and cannot be altered. And I'll point out that when we get to that section. By the way, what I will not be doing in this video is listing the insurance companies that have these features as part of their supplement plans. Now, this is in part because some of the features are state-specific and not available everywhere. Also in part because some states have laws that forbid me from doing so before you have a supplement with that company. And in part because I want you to reach out to us for those details. We don't make our living from YouTube views. In fact, most of my videos are not even monetized, and the views that we are compensated on are not enough to pay for an office lunch. We make our living when an insurance company pays us to help you with your application. So if something interests you, give us a call or use the Contact Us form on my website and linked below, and we will see if we can improve your coverage and lower your costs while adding other benefits. It costs you nothing to speak with us. So the intent of the rules to stop us from talking about Medicare Supplement extra benefits is to make sure that the consumer doesn't purchase a policy based on the extra benefits. Consumers should always focus first on the major healthcare benefits of a policy before considering the extra benefits. And I agree with that 100%. We first help you find the Medicare plan that is right for you, then the insurance company with our highest expectations of price stability. Any extra benefits are usually last in line as a consideration. All right, moving on. A second tier of extra benefits offered by some Medicare supplement insurance companies are dental, vision, and hearing discount plans. Now, these may include other services like a 24-hour nurse hotline. Discount plans help you save a lot of money on dental, vision, or hearing services, but they are not insurance. And I'm going to leave a link to the dental, vision, and hearing discount plans you can access as an affiliate link, and you can see that in the show notes below so if you want to see what is available in your area. Discount plans are very inexpensive, which is why the insurance companies use them with their supplements. From experience, I can also say that they're more difficult to use and have more restrictions than a simple dental, vision, and hearing insurance policy. Also, when discount plans are an extra benefit, the insurance company can alter or discontinue which discount plan benefits that they offer at any time. Keep in mind, individual dental insurance is much better coverage and offered by these same insurance companies. They don't want the discount plans they offer to compete with their own dental insurance sales. Now, I'd like to know how you feel about these discount plans. If you have a supplement policy that includes these extra benefits, please tell us below what your experience has been and any comments, anything that you can add below. I'm very curious to find if any of you think they're good value or not. So next, a third tier of extra benefits that you can find, and this is where we start to get into the benefits that I personally find worthwhile. It's the ability to change your supplement plan without medical underwriting. So very few companies offer this benefit. The most common among them in this category as an extra benefit is the ability to move down in coverage without medical underwriting. Now that means that if you have a Medicare Supplement Plan G, but let's say the premium increases are working too hard into your budget, you can move to a Plan N to lower your cost with the same company no matter what your medical history may be. Or if you have a Plan N, and you can do the same to move down to a high deductible Plan G. Now be careful with this benefit because some insurance companies, they'll let you go down in coverage, but will do so at a rated price, not the same price that you would get if you were underwritten. In other words, you have a higher premium than you would get if you qualified through medical underwriting. So don't assume that the price they give you is the same as a fully underwritten price. As an aside, all the insurance companies that I choose to work with will move you without that rating. For you, I would suggest if you're going to do it without our help, you first get the price of the plan if you are underwritten, and then compare it to what they offer you when you're moving without underwriting. Now, what else do we have? Well, I know of one insurance company that if you start with a high deductible plan, you have the opportunity to move up in coverage during a 30-day window on your second anniversary. You can get any other plan with them during that time period. And this is great for people whose health deteriorates before their second anniversary. Or for some, they are then taking their Social Security income and can use that to help pay for the higher cost, the higher benefit Medicare supplement. Next is my favorite extra benefit. Now, before I go over that, I would like to ask that if you find this information useful, please subscribe to my YouTube channel, like, and share, and comment on this video. It helps me get the word out to more people who should also hear about this information. So go ahead and hit that subscribe button down. There's one insurance company we work with that has bundled an ability to change plans without underwriting for a limited period of time with a unique benefit of covering all your preventive care, even if Medicare denies the claim. Now, anyone who's had original Medicare for a few years knows that one of Medicare's biggest weaknesses is its preventive care. Original Medicare calls their preventive care wellness visits. Wellness visits are paid 100% by Medicare, but they're not the annual physicals that many of us are used to having prior to getting Medicare. The original Medicare wellness visits do not cover everything that many of us would like. For example, cardiovascular screening can only be done once every 5 years on a preventive basis. And I'll link the Medicare's Guide to Preventive Services below. The bottom line is that many people find Medicare's preventive care to be inadequate. At the same time, we all know that proper preventive care is what saves lives and extends our quality of life. So with this insurance company, you can get whatever preventive care your doctor advises. If Medicare doesn't cover it, the supplement plan will. In some states, this extra benefit comes with the policy. It's just part of your policy. In some states, it's offered as a separate rider for your policy at a very small extra cost. In both cases, it can't be taken away. Now, sadly, in some states, this benefit's not yet available, but it is expected to be available in most states soon. Now, the same company has, in many states, a unique, innovative high deductible plan that includes the benefits I just mentioned, as well as the eye-opening surprise, their high deductible Plan G automatically converts to a full Plan G after 2 years without increasing the premium. Again, this is not yet available in all states. To be transparent, this is an A+ rated company, and their Medicare supplement plans cost a bit more than some of the other companies that we work with. But in my opinion, the extra benefits are worth it. So there you have it. Extra benefits with Medicare supplement policies. Now, if you know of other Medicare supplement extra benefits that I've missed, please let me know in the comments below. Please don't forget to like and subscribe for more Medicare content, and then share this video with your friends. Reach out to my office. If we can help you with your Medicare in any way, we would be happy to talk with you. I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching.